It is still Cancer Awareness Month, and the rising burden of cancer and its high mortality rate in sub-Saharan Africa is the reason the Nigerian Air Force officers' wives is raising awareness in the barracks. The groups insist raising the level of awareness of members of the Air Force base is a good step in reducing mortality. And Sifonesian reports.
Cancer poses a public health challenge and is responsible for 1 in 6 deaths globally. In Nigeria, it is responsible for 72,000 deaths with 102,000 new cases diagnosed annually. The grim statistics inform this awareness by the Nigerian Air Force Wives Association at the NAF base, Abuja.
From an Air Force perspective, the medical branch has observed with great concern an increase in the number of serving retired personnel, including spouses, who are being diagnosed with various forms of cancers. Some of these cases, unfortunately, present to hospital very, very late, by which time treatment will make very little impact.
The group believes raising the level of awareness will curb the mortality rate among residents of the military community.
It is important to reiterate that many of the cancers can be effectively treated, and this should encourage people to go for early screening. We must stay vigilant and take actions to reduce the modifiable risk factors associated with cancer. I encourage all of us to continue to help spread this message to friends, colleagues, and families whenever possible in order to start taking charge of their lifestyles for better health.
Reports have shown that public health challenges could negatively impact on military operations if not properly addressed. Sifonesian, TVC News, Abuja.
And joining me now to speak more about the scourge of cancer is the head of Oncology, National Hospital Abuja, Dr. Chinedu Arua. Good to have you join us, Dr. Arua.
Thank you. It's a pleasure meeting you.
So I saw a report just days ago about 2 families where mother and daughter have been diagnosed with cancer, and one of them is even in a very terrible state, had gotten to a terminal state. And these are 2 families, mother and daughter. It was really heart-wrenching to see families going through that, but it was also eye-opening. And that's because I then realized the importance of knowing one's family history. Talk to us about that.
What happened in cancer journey is that most patients do not know about, they don't know about what cancer is all about, and the need for screening and early detection and seeing their doctor at early stage of the disease. And at the same time doing what we call genetic profiling to actually know whether they have a risk of developing cancer or not. So most often what we have is a poor health-seeking behavior, whereby the patient presents to the hospital very late, and that presents a big challenge in terms of cost of treatment and at the same time challenges on the caregivers in terms of taking care of the patient. So in that case, it is this inability to actually distinguish when to be in the hospital and when not to be that have been a big challenge in our environment.
So what can we do? Because I know that for women, breast cancer and cervical cancer are the leading cause of death. That's for women. Generally, it is lung cancer for everyone. But for men, it is also prostate cancer. Some, like you just talked about, not knowing one's genetics and family medical history. What can people do in that regard to ensure that they know on time if they're susceptible and then the steps to take?
Okay, what happens is that creating this awareness, which we are ongoing now, is very important. Like the World Health Organization has set out October 19 every year to mark World Breast Cancer Day. So the aim is to create awareness and to give patients a better health-seeking behavior. And that can only happen if people are actually aware of their health and able to undergo those little milestones that are going to transform their health in a better shape. And what is that? Is like a woman knowing how to do breast self-examination, in which case she is able to understand her breast very well and detect if there's any change in the breast through daily examination of the breast. Maybe when she's bathing or when she's lying down on the bed, having a night rest or afternoon nap. Another thing is about doing mammogram and breast ultrasound occasionally, which will help the patient to keep abreast of any change in the breast. And those are the things that people do regularly, and in that case, we are able to see cases at early stage and actually intervene appropriately. Then another thing is a case of whereby we work hand in hand with our epidemiologist, in which case we try to know the number of cancer incidents and mortality, and thereby follow the trend and know appropriate intervention to follow.
But is there also just a lifestyle that people can live, whether in terms of daily activities, diet, that people can do just to live a healthier and longer life? Dr. Arua, my question is, what are some of the daily practices that we can imbibe in terms of daily activities, diet that we can imbibe to help us prevent, or at least prevent cancer for those who have not been diagnosed with it? All right, I think we lost connection with Dr. Arua there, but he did make very good points there. Daily examination and ensuring that you visit the doctor. You cannot be too careful. We just want to say thanks to him for that.